right, I see some hands up. Great, thank you all. All right, well, we'll get started. And again, thank you for joining us today. My name is Mike Nicholas. I'm the CEO of EF Senior Care. EF Senior Care started out as consultants for skilled nursing and assisted living facilities in Massachusetts. But over the last 6 years, we've expanded elsewhere into New England. We also now third-party manage 4 senior care facilities, and we bought 2 SNFs of our own. And I guess most importantly for today's webinar, we've successfully completed attachment 1, which the fact that you guys are on here, you've probably dug into that. So that's a challenge. So happy to share what we have. Now, with that, I will clarify that I am not an attorney, nor do I play one on TV, and which is just a short way of saying that, I'm not here professing to be a definitive source of how to fill this out. But last year, in the early stages of the disclosure requirements, we did successfully go through. And so the hope today is that some of the lessons that took us a while and a lot of back and forth to learn might benefit you from the start. Though if you're on the call, you've probably dug in yourself. So we'll have time at the end for questions if any of you want to share your particular experiences or challenges. So how did we get here? Just very briefly, it's been several years in the making, the ownership disclosure requirements. In February of 2023, there was a proposed rule. And then after comments, the final rule was promulgated in November of 23, and the rule became effective October of last year. And the original plan was that in the fourth quarter of last year, every skilled nursing facility in the country was going to get an off-cycle revalidation notice that would require them within, I think it was either 60 or 90 days to complete attachment 1. And then that was subsequently delayed. So as it is now, in 5 weeks, on May 1st, every skilled nursing facility in the country is supposed to submit to CMS attachment 1. For their relevant organizations and individuals. When does it apply? So as I mentioned, there is this current revalidation process going. It also applies whenever you file an initial Medicare application, whenever you have a change of ownership, or whenever any of the information that you've submitted changes. So we'll touch on that later, but it really creates an ongoing obligation to be monitoring the entities that you've reported, and if they change, to go ahead and submit an update. So what does it mean? What's the behind it, the scenes? Basically, the federal government wants to know the organizations and the individuals who own your facility, and they're trying to pierce all the ways that owners, operators, managers can obscure those ownership interests. Some of the information in attachment 1 was previously required, but it was typically limited to those with a 5% or more ownership interest and not as many ancillary entities. That's not true anymore. So anyone who has any ownership interest in your facility and a host of different other organizations related to your ownership and operation need to be disclosed. And CMS is explicit in the guidance when they say, when in doubt, disclose. So there's a bias towards disclosure. From our perspective, if you have nothing to hide, it's a pain to comply. But if you do a good faith effort, I don't think that's going to be punished if you've erred in some way. Now, if you choose not to respond, or if you're intentionally trying to mislead or obscure your ownership, then it might be a different risk for you. What happens if you're caught? Who knows? Don't know. I don't know that they've caught anybody yet. So I guess it's your call on how you want to proceed. But if you're on the call, obviously you take it seriously. So, in talking to some folks, including some lawyers, This may be the case of it's another tool for the feds if they find bad actors, that on whatever other things you may or may not have done, if they find that you haven't submitted your ownership information, it could be used against you. So where do you start? Those of you who had signed up yesterday got emailed copies of some of these with a reminder for today's webinar. Basically, the information is at the CMS website, and it starts with the 855a application. And interestingly, right, there are 17 different kinds of medical providers, including skilled nursing facilities, who use this application for Medicare. And that includes hospitals, hospice, home health, PT, OT, speech therapy, opioid treatment programs, you name it, 17 different kinds. Congratulations to skilled nursing facilities. We are the only ones that have our own attachment. So we're the only ones now that have attachment 1. It appears, I think, on page 50, starts on page 52 of the application. And then there are separate sections for organizations and then individuals. The other important piece that's helpful is the guidance for the form. Now, when the program was first released at the end of September, there was an initial guidance. Since then, guidance was reissued in October. It was reissued again in November. It was reissued twice in December. So if you looked at this and you set it away, and now you're coming back to this, make sure that the version you download has December 20th up here, because that's the one that's been updated throughout the process and has the latest and the greatest information to help you. Part of the struggle for us was we started doing this off of the initial guidance, and then each time the guidance changed, it impacted how we had needed to complete our forms. So make sure you're starting in the right place. So, okay, I mentioned this attachment 1, who do I need to disclose? When you get into the application and the attachment 1, you will see the organization form, which is, I think, something like 8 or 10 pages. And then there's the individual form beneath that. But, the way we think about it is that organization form, the first one is for your skilled nursing facility itself. But then there are all of these other organizations which will need that same form filled out for them. And that includes direct owners of the skilled nursing facility, indirect owners, partners, depending on what kind of partnership, the financial institution that holds your mortgage, if there's an entity that leases or subleases real property to the facility. And then it gets even more complex because you've got these various additional disclosable parties, which are those that will provide your skilled nursing facility with managerial or operational control, administrative services, clinical consulting services, accounting services, financial and cash management services, even if they provide you with policies and procedures that are customized to your facility. All of those are organizations where you need to be thinking, I got to fill out that organizational attachment with them. And that even includes like staffing agencies, pharmacist consultants. If you're a nonprofit, your board. So it's really in this additional disclosable parties where things can get confusing. So once you've identified those organizations, then each organization, there are individuals, either one or in many instances, multiple individuals who, depending on their role, also need to have the individual form filled out. So we'll go into that in a little more detail, but we kind of think of it as a matrix like that, where you've got all your organizations and beneath that, all of the individuals within them, where there's an obligation to disclose. So for the individuals, it's similar, right? If the individual is a direct owner or an indirect owner or a partner or holds your mortgage, but also officers and directors, if you have a governing body, if there are the administrator of your facility and the medical director are managing employees, and they have to be disclosed as well. Um, and in many of these instances, it's regardless of their ownership percentage. So for our SNF, we ended up having to disclose 21 organizations and 65 individuals. And those are unique individuals. Some of them appeared multiple times. Um, so, and just to give you a sense, I mean, our SNF has what I would consider a traditional PropCo, OpCo, MCO structure. We have about a dozen investors. We have a mortgage, and we have some related party service providers and some third party service providers. And when we were done, this amounted to 678 pages of those organizational and individual forms. So, yeah, it can be, you can have a simpler structure for sure, and maybe you'll be 300 or 400 pages maybe, but I'm not trying to scare folks, but it's a lot of work. And if you have 5 weeks, you probably want to get started if you haven't. Um, yeah. So as we were digging through this, right, how do we even start? So one of the other things you need to submit along with the organization and individual forms are org charts, and they require you to submit 3 org charts. And we found that that was actually the best place to start, because by drawing out the organization for our skilled nursing facility, that allowed us to identify the other organizations that needed to be reported, what their ownership structures were, and then allowed us to identify the individuals that we needed to complete it for. So I'll give you an example. I redacted the names, but this is what our org chart, the first org chart, showed. So EF Senior Care, right, our parent company, down on the lower left, right, we own our management company as a subsidiary, a consulting company. We own another subsidiary, which then owns our part of the PropCo. So when you look at starting with the skilled nursing facility, right, that is the operator, we have the direct owner, who is the licensed operator. We disclose our administrator and our medical director. Our management company and our consulting company provide services that qualify under their definition of additional disclosable parties. We have a bank that has our mortgage. We have an accounting firm that we use. We use 2 staffing agencies, and then we have 2 entities that lease real property to our skilled nursing facility. And the primary one is the PropCo, right? So beneath that, who are the owners of our PropCo? So EF has our piece of our interest in the PropCo. There are 2 members of the PropCo who are LLCs. One's a corporation. There are 3 trusts, and then there are 7 individual investors. And once you kind of can frame out your structure, it really, I think, helps with figuring out, okay, what do I need to do to complete attachment 1? So the second chart, right, I mentioned here under the PropCo, right, the organizations and then the individuals. For organizations, they request a description of the ownership, right? So in this case, this subsidiary is owned by another subsidiary, which is owned by the parent company, which is owned by 4 trusts, each of which have 2 trustees. So that's basically just tracing ownership of that entity. Similarly, for the LLCs, the corporation, or the trusts, it lists the key individuals in there, whether they're a member, if it's an LLC or a corporation, or if it's a trustee. So again, you have to submit this anyway. So I think it's a good place to start. And then the last one, which is where it can get to be a bit of a challenge, are really the ownership and organizational structure of these additional disclosable parties. So I mentioned, these green ones, right? Those are our own related entities. So it's easy for us to fill out information for the organization and for the individuals. But, when it comes to your bank, right, you've got to go to them and try to find out relevant information, right? Ours happened to be a mutual holding company, which doesn't issue shares. So, we provided that information. In the case of our accounting firm, they didn't provide us the details we needed. So we'll discuss that in a bit as to what you need to do if you don't get the information. Of the two staffing agencies that we use, one of them provided information about the organization and about the individual. There's a single owner of that. The other one also didn't disclose. So again, I think it's a good way to sort of start the process to make sure that you've at least identified who you should try to get information from. So what do organizations need to disclose? If you go to that December 20th guidance, starting on page 9, and the guidance has improved over the 5 different releases. So it helps explain what goes into these 5 sections. So section A is just the high-level identifying information. Section B is what type of organization. Is it a for-profit, a not-for-profit, a corporation, you name it. And then if the organization that you're filling out the form for is a chain home office, then you have to complete section C. Now, if you don't know what a chain home office is, it doesn't probably apply to you. If you are part of a chain, somewhere there is a chain home office in your organization, and for that form, for that entity, if they're related to you, you would need to complete some information about the chain home office. Probably the most complicated is this section D. And this pertains to the relationship that this organization has to the SNF or to another ADP. So basically, questions 1 through 5, you're going to answer one of those about direct ownership, and it depends on your structure. So if you're an LLC or a corporation, when you read through it, you can see you're going to answer one of those questions. And similarly, you're going to answer one of questions 6 or 7, depending on the structure of the SNF. So in our case, our SNF is an LLC, but we know of plenty that are nonprofits that are corporations. Depending on the answer to that, depends which question you need to answer. And then once you get down to the question 8, the mortgage interest, then you're answering questions regardless of the structure. So in most instances, you're going to answer all of those. If it doesn't apply, it's a no. Questions 10 and 11 have to do with that managerial control or administrative services and ask informations, including the effective date when that entity started providing those services to your SNF. If you lease or sublease the property, you need to include information, including ownership details about the organization. Similarly, questions 14 through 18, again, any additional disclosable party of the skilled nursing facility, you need to include ownership details. If you go through them using the guidance, you should be able to figure out, how to answer those questions. And then the last thing you have to do is if you have any adverse legal actions, right? So if there have been any convictions or sanctions or other things, there's a list CMS provides. It doesn't go back forever. I think some of them go back 10 years. But for each organization, you need to answer, if the answer is yes, you have to provide details about that action. So that's kind of what the organizations need to provide. I think similarly, for the individuals playing various roles within those organizations, there are 3 sections to the individual form that you need to fill out. And that guidance starts on page 14. And one thing of note, and this is one of the things that changed through the different guidance. So if the individual is a 5% or greater owner of the SNF or a partner in the entity that has an interest in the SNF, or the managing employees, so including the administrator, the medical director, the corporate officers, you need to provide their social security number and the date of birth. as part of the identifying information. For everybody else who's an individual with one of the ADPs, you do not need to provide that information. So just keep that in mind. I know that particularly when you're going to third-party ADPs, it they can get a little it can get a little daunting. Before that was clarified, we had to go, like, for example, to our bank and ask their 17 directors and officers for their birthdays and social security numbers. They weren't real keen to provide that information. So you don't have to do that anymore going forward. So it's really more for those people who have an active ownership or management role in the skilled nursing facility that you need to provide that level of information. Um, a lot of the same information for individuals. You answer depending on the structure of the SNF. You pick some of those early questions, which one's appropriate. There are a few additional questions. For example, if the individual is a member of your governing body, if they are the administrator or the medical director, if they're an officer or a director or manager of any of the ADPs that are listed, you need to include information for them. The other thing that can get a little complicated here, we found, is, I showed you on that org chart, there were a lot of related boxes to EF senior care. So as you might imagine, I have different roles in different organizations similar to some of my colleagues. And our ownership percentage may differ depending on which entity it is. So it can be complicated to fill out the form. So in that case, we confirmed and were able to use an addendum. So what that looked like was, for example, for question 18, it said, for ADPs that are LLCs, does the individual have any ownership interest? Well, in our case, individual X has an interest in 6 of the ADPs of our facility with different effective dates. In these cases, it was indirect ownership, and then we put in the exact ownership percentages. Similarly, when you get to question 23, it's a little bit broader. You don't have to disclose the effective date or the ownership percentage, but you also have to relist the LLC ADPs, but also any other ADPs that individuals were involved in. So in this case, they also played a role with the SNF itself, and the 7th entity was actually a trust that was an ADP. So those were some of the things that, as we were first going through, there wasn't a lot of clear guidance, but I think having gone through this and been approved, I think there's some hints that this kind of approach is acceptable. So, and then similarly, any individuals who have any adverse legal actions need to disclose those that they do. So how do I keep track of all the information? So, this was one of the hardest things, was, how are we going to track all of it? Because if you're trying to track it on the PDF itself, it can get quite messy. And then you end up, obviously, if you have almost 700 pages, it's complicated. So we created an Excel spreadsheet. And so I basically took all the information that's required in attachment 1, and we put it into an Excel spreadsheet, and each organization got a tab with all the required information from the PDF. Each individual got a tab with all the information, and we used that to track down all the, everything we needed that would allow us to fill out the form. The other thing that turned out to be quite helpful from this, as you can imagine, now we're talking an Excel spreadsheet that has dozens and dozens and dozens of organizational and individual tabs. But what we found was really helpful is, and again, I can tell you from experience, if you send attachment 1, whether you just send the forms or the whole attachment to one of your third parties or your bank or whatever, they're not going to have any idea how to fill it out because it's confusing. And it's confusing, even if you're the SNF and you're trying to figure it out. I mean, it took us weeks and weeks to figure it out. So what we ended up then doing was we basically sent each individual tab to the ADP and highlighted what they needed to fill out. So when I said earlier, they have to answer one of 5 questions depending on the business structure of the SNF. Well, in our case, our SNF was an LLC. So we only sent them that question in the Excel spreadsheet. Fill that out. And then beneath that, what individuals do they need to fill out? And again, since they didn't need to provide social security number or date of birth, we deleted that from the spreadsheet. So it was a bit of work for each ADP, but it made it much easier for them to say, this is what we need from you, not anything extraneous. And I think in hindsight, it helped us. Obviously, there were 21 organizations. There were probably 7 of them that were related to us. The others were our investors, their trusts, whatever. It made it a lot easier, I think, for them to comply. So I mentioned earlier that our accounting firm, one of our staffing agencies, didn't respond. And that's okay, because part of the guidance now clarifies that while you're expected to use maximum feasible efforts, and this is a quote right from it, in part, there's no definition of maximum feasible. It says beyond its plain meaning. And you don't have to make multiple attempts to obtain the information if they refuse to provide it and you can't get it from other available sources, either because you already have it or it's available on the internet, as an example. What they do say is, so there's a distinction. If they say they're not going to provide it, that's all you have to do. If they don't respond, they recommend that you ask a second time, which is what we did in the cases. And again, it's a recommendation and not a requirement that you document any efforts that were made. So whenever we made a phone call or an email, we kept a record of it. And you do have to notify when you file a brief statement listing that you couldn't get the data. So what did that look like? So what we did was, for our accounting firm, we just attached this to the PDFs, and it said that, this firm provides services, multiple emails and calls. They acknowledged they should provide it, but they didn't. On their website, there was a list of their team members and board members, and we just represented that none of those people have an ownership stake in our skilled nursing facility, or, to our knowledge, any of the ADPs. So, that's obviously quite useful, particularly with these third parties that, may not understand it, may not want to comply. In our case, I think our bank were the only healthcare loan they have. It's a smaller bank. So for them to try to provide all this information was, hard. But one other thing that will also help you is what we learned after we submitted. In some instances, we submitted everything except, for example, the final adverse legal actions, where one of the organizations said our board members aren't going to answer all that. So we submitted it, and then just in that answer just said they wouldn't disclose it. The MAC actually, who reviews this on behalf of CMS, they actually came back to us and said, if you can't get all the information, don't submit any of it. So that's also a useful piece of information, that if you're struggling to get all the information from an ADP, as long as you've asked, sufficient amount, you don't have to submit it. You can just say they wouldn't provide you with the full information needed. So hopefully that'll save you a little bit of time if you run into that roadblock. All right, so you've done your org charts, you've figured out the organizations and the individuals, you've filled out the ones you can control, you've asked the third-party ones, you have all the information back now. So, what do you do? You have 2 options. You can go into PCOS and submit it online, or you can just take the completed PDFs of attachment 1 and send them to your MAC. And I say here we opted to submit the forms. reality is we would strongly encourage you not to try to enter it into PCOS. The PCOS version does not perfectly align with the PDF form. Um, certain fields only open based on what you choose up above. And if you realize, oh, I should have selected something else, it doesn't save the relevant information. It goes away. So we started and we quickly abandoned that. And instead, that's why I know it was 678 pages, because at the end, we captured all of those attachment ones into one, set of PDFs, and just sent them off to the Mac. I think, to be honest, on their end, they then have to enter it, but it wasn't our problem. It took about a month of back and forth with them. Again, we were on the very early stage of this, but the application was approved. I can tell you they did more than just put it on a shelf. We made a error on one of our tax ID numbers. It was off by one digit. They ran it against something and they found the mismatch and came back to us and said, I think this is a mistake. You need to correct it. So at least back then, there was some level of scrutiny going on for that. And now I mentioned this, the kicker is once you send it in, you get your revalidation approved, then anything that changes, you have to submit an update. And for these 5 categories here, a change in a 5% or greater direct or indirect owner, a change in the partners, regardless of a percentage, your managing organizations and employees, including your administrator or your medical director, you have 30 days to submit those changes. And then any other changes to data that you submitted for any of your ADPs or the individuals, you have 90 days to submit the change. So, I'll be honest, once we submitted it and we got approved in January, I don't think there have been changes, but we haven't been paying as close attention as we should to our ADPs. So that's something that we have to figure out. How are we going to do that? Are we going to do it quarterly? I don't know. We'll definitely do it probably at least annually. If you add a new staffing agency, you're supposed to report them within 90 days. So, one of the things we're thinking about in our facilities is any entity that we now know is an additional disclosable party. As part of onboarding them, we're going to seek to get this information right from the beginning. So when we're signing a contract with a new staffing agency, we're going to say to them, we need to know this information about your organization and about the individuals, who own it. But again, it's a pain. But I think if you put together a process that works for you, you can stay on top of it. So I know that some of the attendees who said they were going to join us aren't representing skilled nursing facilities themselves, but they may be a service provider or an ADP. So here's a note to them, right? I encourage you to complete your own organization and individual attachments and your org chart so that you can share them with your clients. I mentioned that we are a third-party management company for several clients. And we also provide clinical consulting for many more facilities. So those, and here's where one of the things that can get confusing, but so those entities that we provide services for should be disclosing us as an additional disclosable party. So we are providing them with as much information as we can, and we're trying to customize it. So you heard me mention earlier that some of the answers depend on what is the business structure of the SNF. So our management company provides services to our own SNF, and our own SNF is an LLC, which means that we answer a particular question for our management company. Now, one of our clients that our management company provides services for, they're a corporation, which means we have to answer a different question on behalf of our management company. So just be mindful that It's probably not the case if you're a service provider. If you have multiple clients, you need to review and make sure that depending on that SNF structure, you're answering the right questions for them. So. And then lastly, I'm sure I clarified everything and nobody has any more questions. But if you do have a question, I would suggest that you can definitely go to CMS. So they released this email address for questions. And, I have no idea what's going on today, but back in December, they were very responsive. In fact, there were periods of time where it was almost like text exchanges. I would send an email to that email box, and within a few minutes, I'd get a response, and then I'd ask a clarifying question and get it back. Again, that all wrapped up pre whatever's going on with CMS now. So I don't know if that's still the case, but I would start there. Back in the fall when we started, our lawyers really didn't, we spoke to multiple firms. They really didn't have much guidance at the time because it was new to them. I know since then, a number of them have gotten across this. So I would certainly, if you have questions, suggest you go to them. I think the MAC, as they've received more of these, they're likely going to reach out to you for clarification anyway. So you might start with them because they're on the front line of learning more about how to fill these forms out and enter the information correctly. And then lastly, we're here to help. We're still not lawyers, but you can feel free to reach out to me there, and we'll be able to help. So I believe that some folks may have submitted questions. Let me look at those. Yeah, okay, so one of the questions was who in the organization is completing the 855a, or are you using an external source? So in this case, I took a big role in it. Partially because I knew many of the ADPs, including the investors. Patrick Flaherty, who's also on here, he was also heavily involved in it. But yeah, I mean, it was new to us, and we were under a separate deadline because it wasn't just our normal revalidation. So we wanted to get it done. So I played an active role. And then there were a couple questions about the presentation. Yes, it will be sent out. And I believe, Patrick, that a video of it, right? A recording of it will be submitted as well. Is that correct?
That's right. We'll have a recording posted for everyone as well. You can refer back to.
Great. Okay, and see questions coming through, so that's great. If folks have them, please send them through. So if we are a consulting company, then we only have to provide company name and type of company. We do not have to provide all the other information if not an owner of the facility. That's not quite true. So for example, when the clinical consulting services that we provide to our own facility, we had to identify that organization. We had to answer all of the organization questions about it. We have to identify the individuals associated with that, including the clinical lead and who are the members, the owners of that entity. So in fact, bear with me one second. I'm just going backwards here to show you what I mean by that. So here, right, for this related consulting company, we completed the 4.0 was the org, the form, which I think starts on page 55 or whatever. And then the managers, and by that, I don't mean, I mean like it's an LLC. So there's legally somebody who is the manager. There are two managers. And then the clinical lead was an employee. So we had to fill out individual forms for each of them. So yeah, it can be daunting. Any other questions? All right. Well, I want to thank everybody for joining us. Yeah, I mean, I hope you guys can learn from some of the lessons that we had to more slowly and painfully learn. And if you feel free to reach out, and I hope this was helpful. So have a good rest of the day, and have a good 5 weeks getting these in on time. So thank you all.